A very good morning to all of you. I am Dr. Mala Dharmalingam. I'm Professor and Head Department of Endocrinology, Ramya Medical College, Bangalore. I also am the Director of Bangalore Endocrinology Diabetic Research Center, also situated in Bangalore. Most likely you have been worried about polycystic ovarian syndrome. Maybe you or your friend has it and you might be wanting to know more information about it. So let me tell you what is polycystic ovarian syndrome and what you should be worried about. As a young woman, you'll be worried that I'm putting on weight, I'm getting some facial hair, and I'm having irregular cycles. These are the common symptoms that a girl with polycystic ovarian syndrome has. So don't worry, it's all controllable and you can manage it effectively from your side itself. What should I do? So polycystic ovarian syndrome is most commonly associated with overweight and obesity. One should look at eating healthy. This is very important. I know it's very tempting to have food which is so freely available, all the tasty food. So we do allow cheat days, but not very often. So you should eat healthy. You should have a healthy lifestyle. You should go for a walk and maintain what is called an ideal body weight. So whatever your weight is. So if you lose 10% of it over a 6-month period, much of your problems associated with polycystic ovaries is going to come down. So try to keep your weight as close to normal as possible. The second problem is irregular cycles. This is also due to something which is called insulin resistance, and the cycles become irregular because of an imbalance between the male and female hormone or the estrogen and progesterone. In polycystic ovaries, the two female hormones, estrogen and progesterone, estrogen is in plenty and progesterone is less. So that is why the irregular periods happen. If you lose weight, even this abnormality is set right. But if not, your doctor will prescribe you some 5-day tablets which will cause your cycle to happen, which is called a withdrawal bleed. The other problem, and which may be very important to you, is increasing facial hair or hair fall. The increasing facial hair may be in your face, chest, back, arms, or legs. So your doctor usually has a grading system. They will look at the hair and grade every part of the body which has hair, and if it is more than 8, which is in the medical terminology is called hirsutism score, then they will treat you for that. In the meantime, you will have doubts. Doctor, can I remove it? Can I use a hair remover? Should I go for threading, or should I go for waxing, or should I do laser? There is something which is called hypertrichosis, which is just increase of normal hair, wherein you can go for laser. But however, when it is hirsutism or hormonal cause of hair, it is very thick hair, and laser will not give a permanent cure until you are treated for it medically, and then of course you can go for laser. Be rest assured, this is only a cosmetic problem. Many girls get scared that are we changing gender? Are we getting other problems? No, it's nothing like that. The whole problem of facial hair or body hair, which is thick, can easily be treated, and temporary removal by either waxing or threading is perfectly normal till you get medicated. And if you're not completely assured even after that, you can simultaneously go for laser therapy. Now the other concern is, what does it translate to? Yes, if you don't treat polycystic ovaries on one side, always the danger of getting diabetes is there, which is not a good disorder to get. So I always say that polycystic ovaries is an area of prevention. So if you can treat yourself adequately right here, you can prevent completely getting diabetes in older people, older age group, and also getting diabetes in pregnancy, which is called gestational diabetes. So it's very important. You should take this seriously, do your diet and exercise, see that you're completely cured of polycystic ovaries so that you don't get diabetes when you're older or when you're pregnant. Having talked about pregnancy, many girls come and ask me, Doctor, will I have a problem with pregnancy and what should I do? It is not true that all polycystic ovarian syndrome girls will have problem with pregnancy. Many of them will spontaneously conceive, especially if they've been treated adequately early on and they have now normalized their cycles. Your periods are coming regularly. The chances that you'll conceive on your own, or which we call spontaneously, is very, very high and good. However, if your cycles are abnormal and there is some abnormal glucose, then metformin can be used and you may conceive with that. Otherwise, definitely you can meet your gynecologist and they will do few tests and then possibly advise you on what is best for you. Can you undergo IVF? Yes, that is an option which not many people may require, but a few. Yes, just like in general population, few people require IVF, same way in polycystic ovaries, a few extra percentage may require IVF, but to a large extent, either spontaneously or with a small help with tablets like ovulation inducers, they can become pregnant and you should not have worry. But having said that, it also requires that you should follow lifestyle, regularize your cycles so that all these problems will not happen. Parents need to understand what the child is going through. Many times the mothers will say, my child overeats, she does not play. Many times what I find is a child of about 13 years, 14 years, because of the overweight, have very low self-esteem. They also have acne, sometimes facial hair, and they think that people are looking at them differently, though it may actually not be so. So it not only requires a lot of encouragement to the child, but also an understanding that sometimes we need to help the child help themselves. So encouraging her to do her physical activity, eat healthy food will go a long way in controlling the polycystic ovarian syndrome. In fact, the treatment of polycystic ovarian syndrome is majorly weight loss, wherein the child's insulin resistance will reduce and then the polycystic ovarian syndrome itself will be cured. And then, of course, we have medication which can be used to treat both the irregular periods as well as the facial hair or the acne. To summarize, I would like to address some of the myths and facts about polycystic ovaries. Many children feel that they are overweight, they have polycystic ovaries. No, not necessarily. It should be associated with other problems of irregular cycles and acne or facial hair. Many people feel that I have missed my cycle for 6 months, I must be having polycystic ovaries. No, it may be other problems. There are so many other problems associated with irregular periods, of absence of period, which is called amenorrhea. So if your cycles have been missed for more than 3 to 4 months, please go to your doctor and evaluate yourself to understand what is the cause of missing your cycle, and may not always be polycystic ovaries. Many people think, oh, it's a simple problem. Even my grandmother had it. No, it is not a simple problem. It is a common problem. It's a treatable problem, but you have to take it seriously. Because on one hand, you have metabolic problems of diabetes, hypertension, heart disease, and cholesterol. And on the other problem, you have something like fertility issues. And of course, there is a small increase in endometrial cancer also in a person who is not treated for polycystic ovaries. The other problem people ask me, or other myth the people ask me is, anyway, I don't have cycles and I may not be ovulating, so I don't need birth control pills. This is again not true. So though you may not be having your cycles regularly, you may become pregnant, especially if you are on treatment for polycystic ovaries. The chances that you may become pregnant are there, and you should take treatment to take adequate precaution to see that you don't become pregnant if you don't want a pregnancy. Is it true that you will never become pregnant if you have polycystic ovaries? Many girls feel scared. No, not at all. Like I have shown said in my video, that it is not true, and you can definitely become pregnant even if you have polycystic ovaries. But again, to summarize, I would definitely request all the young girls out there, please go out for that walk and definitely eat good food and disciplined lifestyle to see that all these problems can be prevented.